Good afternoon, everyone. Today we are going to discuss a very important topic, which is cervical cancer and its early detection or prevention. A lot of people are not aware of cervical cancer and how common it is in India. So we actually asked a lot of our patients to put in their common questions, and I thought I would answer those questions in the podcast. So here I have about 8 to 10 questions which I'll be covering. So let's get started. The first question is, what is cervical cancer and what causes it? So cervical cancer arises in a region in a woman's body which is called the cervix, which is connected to the vagina. So it's the lower part of the vagina. It is only present in women, and that is why cervical cancer is a cancer of women. Now, what happens is that, unlike many other cancers, there is a clear cause of cervical cancer, and that is an infection with a virus which is called the HPV virus or the human papilloma virus. So, the human papilloma virus is transmitted via sexual intercourse to the cervix of the woman, and it stays there for a long duration of time. It invades the cervical cells and it causes certain changes in the cells, and these changes progress through a very low grade kind of lesion to high grade and eventually cervical cancer. So it takes a lot of time for the lesion to progress from a lower grade to a higher grade cervical cancer. So our aim here is to detect either the HPV itself or see the cells of the cervix and to see whether they have undergone any kind of change which is precancerous in nature. So the cause of cervical cancer in over 90 to 95% cases is human papilloma virus infection. Now the second question is, how common is cervical cancer? So you'll be surprised to know that cervical cancer is actually the second most common cancer in women in India after breast cancer, and it is the fourth most common cancer in the Western world. Now, the biggest problem in cervical cancer is that most women, at least in India, present to their doctors at a very late stage. So they present when the cancer has already progressed to a higher grade cancer or it has even spread to the surrounding tissues. And at that point of time, it becomes very difficult to treat, and the recovery for the woman is very prolonged and difficult. So, our aim here is to ensure that women get screened for cervical cancer as early as possible and on a regular basis, and we want to detect cervical cancer at the early stages. The third question is, what are the early signs of cervical cancer? Unfortunately, there are no clear cut early signs of cervical cancer because the symptoms are very vague, and most women only get symptoms once the cervical cancer is at an advanced stage. So, the symptoms can be mistaken for many other things. So, the only way really to catch a cervical cancer early or in the precancerous stage is by screening. And I will talk about screening going in the next few questions. And another issue is that cervical cancer symptoms can also be confused for symptoms of other ailments in women. So there are no clear-cut symptoms for cervical cancer even at early stages. Now the fourth question is, can cervical cancer be prevented? Well, the answer is yes to a large extent. Like I mentioned, most of the cervical cancers are what you call as squamous cell carcinomas, which are caused due to HPV, which is human papilloma viruses. So at least those cancers can be prevented before the woman has a sexual history, woman or man for that matter, and the HPV vaccine actually exists, and it can be taken at a young age in the teens as well, and that can prevent cervical cancer. But in India right now the policy is still being developed, but in the Western world, cervical cancer, HPV vaccines are quite commonly given, but you need to consult your doctor before taking any vaccine. But yes, it can be prevented by HPV vaccines. Now the fifth question is, does HPV always cause cervical cancer? That's a very good question, and the answer is no. Now, HPV is a very common sexually transmitted infection, and most women who get HPV infection don't actually develop cervical cancer. But most women who have cervical cancer have got it due to HPV. So there is a difference. But what we can do here is at least we can detect people who have HPV and then follow them up regularly to ensure that there is no change in the cervix which is leading to a precancerous lesion or eventually leading to cervical cancer. So detecting HPV itself is very, very important before it even causes cervical cancer in the future. The next question is how do you screen for cervical cancer? Now, when we talk about a screening test, is that we are just taking women who don't have any symptoms or any suspicion at all of having any kind of cervical cancer, and we are doing what we call a pap smear on those women along with HPV testing. So pap smear is basically we take a brush or a speculum and we take out some cells from the cervix and we stain those cells on a slide and then we look under the microscope to see whether these cells are normal or are they abnormal looking. If they're abnormal looking, that means they could be precancerous and they could be progressing into cancer. So our aim here is to detect precancerous and cancerous cells on the cervix. So that's one way. But the second way is, along with this, you also look for the presence of HPV, which is human papilloma virus, and we have to ensure that if HPV is detected, then we need to follow up this woman more closely and at a more frequent duration. But HPV, if it's not detected, that means at least right now the woman is not infected with HPV, so she can rest easy for a few years and maybe repeat the test after 3 to 5 years. So the two main modes of screening of cervical cancer are pap smear along with HPV. In low resource settings, that is where pap smear is not easily available or HPV testing is not easily available, we have something called as visual inspection with acetic acid. So what they basically do is they coat the cervix with a chemical and they visually see if there are any changes in the cervix, not under a microscope but directly with the eyes. They can see whether there are any changes in the cervix by applying a certain dye, and it causes a color change. So in low resource settings that is useful. The next question is, can cervical cancer be detected in the blood test? No, unfortunately not. So there is no blood test which can detect cervical cancer. The only way is early detection of HPV and a pap smear. And in later stages, what you can do is that if there is a growth which is fairly obvious to the eyes, then you can take a biopsy. A biopsy is basically taking a small piece of the suspected cancerous lesion and then staining it and then examining it under the microscope to rule out the presence of cancer. The next question is, where is it common in metro cities? Yes, it is common across all kinds of social strata. One of the biggest risk factors is starting of sexual intercourse at an early age, frequent multiple sexual partners, and of course lack of an HPV vaccine. And a woman who has never undergone screening of cervical by a pap smear or HPV testing is at higher risk because we have not been able to detect it yet. So any woman who at the age of 35 onwards should undergo a screening for cervical cancer, ideally with both a pap smear and an HPV test. So I think I've answered most of the questions here today. If anybody has any more questions, please feel free to email us. We'll put the contact details below. And in the next podcast, I'll cover whatever questions you have. Thank you very much, everybody. Have a great day.